Welcome everyone to the second in a series of 2 sessions on dashboarding that's being provided through the RISE initiative, which is sponsored by the California Healthcare Foundation. So to those of you who are on the line today live, welcome. And for those of you that will be listening to this in recorded format, welcome to you as well. I hope you're able to find something useful in this training segment. So we're back here today to get into some more technical details about dashboard design. Last week we had a general overview of why dashboards are important, and we talked about some of the important design features of a good dashboard and of graphical display of data. And this week we're going to jump right into a spreadsheet and show you some examples of how to optimally design a good dashboard. So I'm very excited to be providing this training on behalf of the RISE project. It is just the first in a series of support that I'll be providing to the project over the entire course of it, over the whole 2-year period. These 2 segments are aimed at very general training on dashboard principles and approaches and tools and techniques, but what we are also doing is providing very focused and direct support to each of the super regions and consortia offices and even individual centers across the state to help put many of these things into practice at your setting, whether it's in an individual health center or a consortia office. So I'm hopeful that the tools and techniques that we're sharing here, you'll find something useful in them, and that you'll be able to bring back into the workplace. And also encourage you to reach out to me. I've got my email address at the end of this presentation with any questions along the way as you are on your journey to bringing dashboard tools into your organization if you don't have them already. I also would like to encourage you as we go through the presentation to feel free to type in questions in the Q&A box. I will deliberately try to stop and we'll open up the lines for any questions that you might have if you'd like to speak your question. But also please feel free to just type them in along the way, and I'll be watching that Q&A box to see if there's any questions there that I can address on the spot. We'll also have some time at the end. I'm going to try to be a really efficient time coordinator so that I can leave time for questions and answers. So we'll do that at the end. And with that, I'm going to get moving here so I can keep on track. So here's the agenda for today. As I said, we're going to pick up or jump right into Excel and talk about some basic dashboard design principles. And I'm going to share with you some of my approaches that I've used with dashboard design in my, and it's kind of scary to be saying this, 20 years of quality improvement in healthcare. And a lot of these tools that I share with you, they are tools that I've used throughout my entire career, and I can share with you a number of organizations that I've brought them to still have them in place. And so Excel is just a really, really nice agile platform for creating dashboard templates and for organizing the data into a nice presentation report that you can use in your organization for various user groups. So what I'll be sharing with you are what's kind of my top 5 list of things that functions that I think are most important, and design features that are most important in a basic dashboard design. And then I'll share with you a couple of tools and techniques for what I would consider an intermediate and close to advanced dashboard design. And then just very briefly towards the end, we'll talk about next steps, which do include additional support after these general training sessions are over. And of course, we'll open up the floor for question and answer. So just a brief recap of the session from last week. I wanted to highlight what I think were 2 of the most important slides that we went through in the session last week. One of them is about a what are some of the best features in displaying a performance measure. And so I just wanted to emphasize that once again, that what you see on here are 5 traits of this chart that make it a really effective display of the performance measure. The first of them is display of the measure itself, a trend of it over time. This particular graph is showing it quarterly, but you may be displaying data monthly or annually, and certainly all 3 of those levels of a trend in a graph are relevant. In the days when we were all doing manual chart audits, a lot of these measures that we compiled, the best we could do was quarterly, and so many, as short as a few years ago when we were on paper, it was only feasible to do quarterly measurements. But now with electronic health records, and whether it's your EHR or some system that you're using to pull data out and analyze it, like an eye-to-eye or other disease management system, the computation of these measures you can do much more frequently on a monthly level. And so of course, ideally, it's if you have access to tracking these measures monthly, that's great. That's brings you closer to the data and to monitoring it in real time, so that you can make interventions in as close to real time as possible. Another feature of this is having an annual goal. Make sure that you are at least annually going through a process in your organization, creating an annual plan and defining a relevant goal for your organization to achieve. That annual goal should be based upon a third important trait here, some external benchmark. So make sure you're looking at some external benchmarks, whether it's a regional benchmark or a regional or a national benchmark. Last week we shared that my go-to for benchmark data is the NCQA State of Quality Report, and I'm going to talk about that in just a second. But it's very, very important to have these, not only an internal goal, but an external, what you might call a stretch goal, or just a benchmark reference in the graphic. Fourth feature is to indicate which direction is good. And again, you may have users of the dashboard that may not be familiar with the measure, and so it's good guidance to tell them which direction is as well, or which direction is good. Here's the second slide from last week I wanted to just highlight, and that is the bringing together of multiple measures that are related to one another in a balanced display. For us to look at just that one graphic of A1C less than 7 certainly tells us a lot, but doesn't it tell us so much more? Don't we create a much more robust picture by looking at measures of LDL and the volume of the patients that these measures apply to, and the appointment availability? Truly the whole rationale behind a scorecard or dashboard display is to bring together multiple performance measures so that you can interpret them collectively and make some really good or much better decisions as you're reviewing your data. The third slide I wanted to recap was just the Stoplight version of a dashboard, and this display of data is of a dashboard is certainly a very relevant one as well. And in fact, we're going to be showing in this segment how you can teach Excel with a formatting option so that it will automatically color code a range or one of these column so that you don't have to manually color code red, yellow, and green. You can actually create a function in Excel that will do it for you if you're creating dashboards like this. And in my practice, I've created dashboards. I actually like blending the graphical format with the Stoplight format. I've always felt that the graphical format was really important to allow users to look at the trends of data. I think we're all visually cued to following a direction in measures, and so I think that following that trend and following the something going in the right direction or the wrong direction is just a good visual cue for us as we're scanning measures. And then the Stoplight reports, what I typically use these for is a year-to-date summary that gives kind of a one spot to look on your dashboard page to see if you are heading towards achieving an annual goal or an annual target. So I actually like using, and we'll see an example later of how you can bring together a dashboard that has both a trend chart in it and a year-to-date stoplight piece. So these two formats have been the kind I have used throughout my entire career, and I found to be the most useful for organizations. Without delay, I'm going to jump right into our basic dashboard design. I won't go through this slide because I just want to jump right into the training piece and talking about how to create a basic dashboard. And what I'll share with you, this is the template that is available on the CHCF website. It is one of two templates that we have provided to give you some ideas about getting a dashboard started up in your organization. And if you are creating one for the very first time, I think this is a great starter dashboard for you. It's a real simple template. That Excel spreadsheet that's on the CHCF website has just one tab in it with these 6 graphs in it, and a data entry region off to the side. And it's just a great way to begin introducing dashboards into your organization. Typically, dashboards evolve over time. Usually when I go into a new organization, I will create one, a simple one like this, and begin orienting the organization to using it, and we'll grow it over time and build out measures in different domains. You'll see this particular example has 2 clinical measures, 1 operations measure, 1 patient satisfaction measure, 1 productivity measure, which is kind of an operations measure, and then a financial measure of net patient revenue. So this truly embodies the term of a balanced scorecard, where you are bringing together measures from multiple domains of your organization. You're bringing them together to best understand how your organization is performing. And I thought each of these measures, as I think about community health centers all across the country, these are quite relevant for any community health center to plug in maybe 1 or 2 of your plug in 2 of your priority clinical measures. And of course, diabetes is typically one of the top chronic disease conditions that you're tracking. And then, you might pick a preventative care measure like a screening, whether it's colon cancer screening or a mammography, breast cancer screening, whatever is important to your organization. And then days to third available appointment I think we've all found over the years is just a really valuable access to care measure that is really important to display. Patient satisfaction, I think we're going to see that return in patient-centered medical home, where there'll be a patient experience. We'll maybe start referring to patient satisfaction more in terms of patient experience. So that's probably the trend that will play out. But this, in summary, these are, all of these measures I think should be quite relevant to any community health center wanting to start up a dashboard and to just pick a set of measures to work on. So how can you create this? Well, what I have in the presentation here are some screenshots of Excel, which I thought would be best for training purposes. But a little bit later, we can actually jump over into Excel live, and if we have some time, we'll go through maybe some of these, creating some of these live. But what I've tried to do is to provide in this slide deck very explicit instructions for how to do some of these functions. And so you have access not only to this recording, but to this PowerPoint. So you can download it as a reference tool. So when I'm creating a dashboard, if I were creating this 6-chart dashboard, the first thing that I like to do is get organized where I'm going to be putting my charts and where I'm going to be putting my data. And what I found throughout my practice is that I've always liked having the 2 of them together. I've seen many users of Excel put data in one tab and put charts in another, because you're creating a chart, you're offered the option to put it in a different worksheet. But what I found is that it's just nice to organize them, to bring them together, so that as I'm typing data in, I can see the graphic getting updated. And so I've just found it's nice to have data in proximity to the charts. And this format of organizing your data, the region to the right of your graphic has worked just very nicely for me over the years. And what does that region of data look like? A little bigger view of it. Here's how you can organize the data off to the right initially, and this is maybe before you put your charts in. The columns here are going to represent the periods of time that you're pulling your measure together. So this example has monthly measures in it, but you certainly could make this a quarterly. Each column could represent a quarter, or it could even represent an annual. And in fact, you might have both of those types of dashboards where your monthly or quarterly is a dashboard that's being reviewed in quality improvement forums for more operational and tactical purposes. But then you also might have an annual dashboard that looks identical, except that the data points are annual ones. And those are typically really valuable as you're doing strategic planning in your organization once a year or revisiting a multi-year strategy, and you're wanting to trend the performance of your measures over a year-long period. So this layout really can be used at an operational level with monthly or quarterly data, or at a strategic level with annual figures. And ideally, both. I typically set up both of the dashboards with both monthly and or quarterly, and dashboards that have annual figures in them as well, because you want to support both of those processes. The strategic planning for efforts that are only happening once a year, but it's a really important time of year, and so you want to have annual trends of your data over time to help your organization strategize appropriately. But then you also want these monthly or quarterly measures so that you can inform your quality improvement efforts internally. So those are the columns of data. And then the rows of data here we see are just the 6 measures that we selected. And for each measure, there's a row that will allow for the actual value, and a row that is for our target. Notice that the target values on each one of these are the same throughout the year. And that should make sense, because once you set a target, it ideally is a target you set at the beginning of your fiscal year and plug in here, and that is the line that you are aiming to achieve over the course of the year. So that target line really shouldn't change unless you are setting, say, quarterly targets that are a step function, and maybe you work your way up to a goal towards the end of the year. So it's possible, for example, you might have your A1C target. If you're eventually trying to get to 90%, you might have January, February, and March at the 80% level, and then you might have April, May, June at the 85% level, and then you might put July, August, September, and through the rest of the year at the 90% level. So you can create your target line to be a step function if that's helpful to your organization. And I've gone both ways, so I think you should pick whatever works best for you. Just a note on those targets here, I mentioned before I was going to share with you where you get those targets from. And my point of reference for this is once a year, every time it comes out, it's usually around March or April for the previous year, is the NCQA State of Healthcare Quality Report. And this has in it every single one of the chronic disease and preventative care measures that you could possibly want for anything you're tracking in your organization. And in fact, all of the meaningful use measures you'll find in there. And these are just a really important reference point to bring into a graphic and to use in your planning purposes. And I think this is one of the key areas that we are focusing on in the RISE effort is the importance of, number one, trending your data over time is really important. But number two, make sure that you are aiming for the right mark, and make sure you know what the industry norms and benchmarks are so that you can continually challenge your organization upward towards those norms and benchmarks. And I wanted to point out that in that report, you have access to 2 different levels of the data. And I wanted to make sure that I clarify with you what those 2 tiers are, because they're used for different purposes. One is the 90th percentile. That is one cut of the data that the report provides. This is what you can refer to as a benchmark comparison, because it is a provider organization that is performing better than 90% of the organizations in the country. And so NCQA provides the 90th percentile. They filtered out the top 10. There's typically the top 10% are usually trimmed because they are potentially outliers. And so giving the 90th percentile is usually a good clean measure to provide for a high-performing organization. So that's one level to look at, is the 90th percentile, and you can safely call the 90th percentile a benchmark level because that's a best in the country. The other comparison is called the average, and the average is, another name for that is a norm, and a norm is just the middle of the stack. So you want to be careful about using a norm versus a benchmark. And as you can see in this table, the averages or norms are always lower than the 90th percentile because they're the middle of the stack, they're not the top of the stack. Now, what's important to do in your organization is, if your performance on one of these measures is below the average or the norm, then it's appropriate to try to get them up to the average or norm first. And so, that's, if you're well below the average or norm, then set the goal at the average or norm, because that's probably a more realistic target for your organization to hit. But then once you've achieved that, or if you already have and you're above the average or norm, then bump up your target to that benchmark or 90% level. So this is how, through our charts, we can continually challenge our organization to achieve higher levels of performance on these different measures. The third and final thing I'll point out here is, notice that there are different payer classes provided. So Medicaid, what's said here are Medicaid 90th percentiles and averages, and also commercial 90th percentile and averages. And the trend generally is that commercial providers are higher than Medicaid providers, which is due to a variety of issues that we in the community health sector know, because we treat Medicaid typically with challenges with access to care. However, there are many spots where Medicaid providers do better than commercial providers. But if you are already one of the Medicaid benchmark levels of performance, then what I would say is, challenge yourself to become competitive with the commercial providers and go after those benchmarks. And so really you have these three different tiers you can continually challenge your organization to strive for. One might be the average or the norm. The second might be the 90th percentile or benchmark for Medicaid. And the third might be the 90th percentile or benchmark for a commercial provider. So, so use those as you see appropriate in your organization, or any of those levels as you see appropriate, but at least use one of them. I think it's always it's important to bring these into our graphics and charts. I'm going to pause here for just a second. I'm going to try and check our Q&A box here and see if there's any questions about the NCQA benchmarks, or just what we've talked about so far. Just to give us a couple minutes here. If I don't see any chat questions showing up, I might move on here. All right. You're all just wanting to see the next slide, aren't you? Well, I will do that and bring us, move us along here. So let's jump back into the spreadsheet and create just one chart. Let's focus on doing that in our dashboard. And notice in the display here, I have a completely blank spreadsheet. So those graphics that were in the previous slide are now gone, and we're going to create one. We're going to create our dashboard from scratch here with the data that we've entered into the spreadsheet. So the first thing that we're doing in creating a single chart, and this may be a refresher for some of you who know how to do this, but some of you may not create charts in Excel very often, and so this will be a refresher on it. First, you want to select three rows of data, and those 3 rows are, the first row is the header row, which contains that January, February, March, April, whatever your time period is that you're tracking. You want to make sure you select that row and not the full row. You want to use your mouse and click on the cell to the left of the January. So what is column K here? I'm sorry, R. I'm finding it hard to read this myself. And select all the way across to December. And then the other 2 rows you want to select are the actual row. So that's going to be the data points that you're going to be putting in from month to month or quarter to quarter or year to year. And then the 3rd row is the target row. Now, there's a couple of different ways. You'll see in this spreadsheet, I have selected a non-contiguous region because of the way I've spaced my my measures below the months that they correspond to. If you are selecting non-contiguous regions, use your control key and hold down on it while you're using your mouse to select all the regions. And so you'll hold down your control key and then first select all of those, that header row, and then keep holding down on the control key and select the actual and the target rows, and then release the control key, and what you should have displayed is all 3 of those rows together. Now, if you just don't like using your control key and don't want to deal with that, just place your data directly so that it's all continuous and next to one another. So you certainly can just put those months of the year directly above the actual and the target, and you can do that 6 times over for each one of these measures if you don't want to deal with selecting a different or selecting non-contiguous region. So once you've done that, selected those 3 rows and all the columns that are your header column of the actual and target, and all the way off to the right to December, and come over to your insert menu and select that column drop-down button and just pick the most basic 2-dimensional chart here. Many people like to create 3 dimensions and make it a bit more snazzy, and I'm very vanilla when it comes to my graphs. I just like the basic 2-dimensional ones and tend to believe that they're most effective with the majority of audiences. I feel 3-dimensional displays of graphics sometimes distort your the view of where the measure is performing at. And so I, throughout my practice, have just stuck with 2-dimensional charts. They're the most basic ones and easiest to edit as well. 3-dimensional charts are more difficult to edit than a 2-dimensional chart. So once you've done that, you've clicked on your basic 2-dimensional column chart, then what will show up is a graph that looks like this on the left-hand side of the screen display. And you'll notice that it's in selected mode. And what does it mean to be in selected mode in Excel? Whenever you have an object in Excel, if you click on it and handles show up around it and the outer rim gets highlighted, that means that object is selected. And this is what a selected chart looks like, is that you can see around the 4 corners and in the midpoint of each edge, there are what are called handles that you can grab onto to change the size of that graphic. So this view of the Excel chart means it has been selected, and that you can stretch it, you can move it, you can do whatever you want with it. Another thing that happens when you are in selected mode is that you can see the data that the chart is pointing to. So you'll notice that there are these colored lines, red or pink, green, and blue lines that are surrounding our data, and that comes up. That's the chart. That's the chart line. Those are lines that correspond to the chart that we just created when we're in selected mode. So this is a really nice feature. You can tell that and see where your chart is pointing to if you just click on it, and it will reveal these colored lines and show where the data is that it's pointing to. So if you ever lose graphs, you have multiple graphs on a page and you're wondering which region of data they're pointing to, this is a really nice feature to identify where your chart data is pointing to. Another nice feature is that you can take those colored lines and stretch them as well. Notice that they have handles on the corner as well. There's little boxes in the corners, and you can shorten the range of your chart. So if you wanted to make a January through June chart, you can go over and just drag the pink and the blue line, square over to June, and the chart will update to show only 6 months of data versus 12 months. So that's another nice editing feature that that Excel charts provide. So now that we've created our very basic chart, you'll see it didn't show up completely the way we wanted. It created 2-column charts for a 2-column series. One of them is the actual value, and the other is the target. And I don't know about you, but that target, you know, while it's a nice, it's an okay format, what I think would be more visually pleasing and more, and that users can respond to better, change it into a line. So let's see how we can change that target column series into a line. Well, the first thing we want to do is click on top of the column series. So notice now we're in the chart, and you may have to click on the chart once, and then click on that red series again. And this is how it should look. That red series should be selected. And again, you know, when something is selected, handles will show up around it. So you'll notice here that red series is selected, but the blue series is not. Notice there's no handles on the blue series. So what we've done is we've only selected the red series, and that's what we want to do, because that's the series we want to change. The blue is fine. We don't want to do anything to that. So after we've selected the series, then step 2 is go up to your menu option underneath Design. And within the Design menu, you'll see off to the far left, there is a command called Change Chart Type. So click on that, and this Change Chart Type menu shows up. And here's where you can go down and just select the most basic line graph in here. So that's step 3. Pick the line and then say OK to that. And what should happen is it should change that red bar series into a red line series. So we now have what is turning out to be a pretty nice visual display of our data, so far with a line on it. And sorry, I wanted to comment on one other thing here. And there's a couple of things that you could do here to edit this chart. Notice we don't have a title on it yet. And so you can easily add a title by remaining clicked on the chart. Notice our chart is still in edit mode because we have you can see the handles on it. If you click outside of the chart, you'll notice those handles go away. And so you can't edit the chart if you are not clicked on it. So make sure you click on it and it's in edit mode. And then once it is, say we want to add a title to it, then we'll go select layout and then select chart title and tell it to put a chart above, or to put a title above the chart. And that will pop in a title for us, and we can just edit the title with the percentage A1C less than 7 so that it shows up like this. Now, some other formatting things you might want to do here. Something I like keeping my time series or my x-axes always vertical rather than at a slant. I'm not sure why. It's just something I'm programmed to always put the time series vertically rather than at an angle. I think it's an efficiency thing. Once you have multiple periods, you can get better use of the space if they're all vertical. So what if we want to change that orientation from an angle to a straight vertical x-axis display? Well, one way of getting in to edit that x-axis is to click on top of the series. So notice if I click anywhere along that January through 12 all the way up to November region, click anywhere there, then you'll see that area becomes selected. And it means when a line shows up around the region, that means you have selected that region. Once you've selected the region, if you right-click, this menu will come up that provides some editing options for you. what we're going to do is go into the Format Axis button. And I'll show you in a second what that menu option looks like. But I also wanted to show you that there's another way of getting at that same exact menu option. And if you go up into your Layout menu and then go into Axes, Primary Horizontal Axis, and then More Primary Horizontal Axis Options, you will get the same exact menu option that is now displayed, 2 different formatting options that you can adjust for that x-axis. So Excel has many different ways of doing it. I would say the approach A here is one of the easier techniques that I use. Typically, if you click on something and select it and then right-click, a menu option will come up. But you can also click on it and go up to the top to the menu options at the top of Excel and find the same option somewhere in the header menu options. So whatever you're comfortable with, feel free to use. But there's usually a couple of different ways of getting to these menu options. So the 2 options here that I've got displayed are, one of them is for changing the range of values. So this is another place where you can shorten, if you wanted to shorten what is being displayed in your graph, you can select the beginning and the minimum and the maximum range that's being displayed. You can also change the increment being displayed. With date formats, it's a little bit trickier than if you have category variables showing up here. But there's lots of nice flexibility for editing that x-axis. And then a second menu option is under alignment, and here's where you can change the direction of that x-axis from a slant into a vertical. And so once we do that, here's what it looks like. I've now adjusted my time series to be horizontal, and we've got our very first dashboard in place and resized and moved off to the left, and our dashboard is 1/6 complete. So we just create that, or go through that same exact process for our 5 other graphs, and our six dashboards are complete. I'm going to pause here for just a second, and feel free to toss any questions in that Q&A slot. I'm continuing to watch it if you have any questions. Otherwise, I'm going to move us along here. So the next most common question I get is, how do I fit all those charts on one page? Well, what you do is, first of all, select the entire region in your spreadsheet that contains all of your graphs. So this is selecting the cells. You're not selecting the charts, so don't click on the charts. Select on the cells underneath the chart. So you'll see what I've done here is I've selected the region from A1 all the way down to P, it looks like P35 or so is the lower right-hand corner. So I select that entire region, and then I go into my print, underneath page layout, I go into print area, and I click on set print area. So that tells Excel that this is the whole region that I want to display on my dashboard page, is all 6 of these graphs. So that's half of the setup for it. The next thing we want to do is go into our print preview button. Now, Excel doesn't automatically have this displayed on your desktop, and so you might have to put this button in on your header menu. But you want to go into your print preview button, that's step 1. And then step 2, go into page setup, and you'll get this menu option with underneath the page tab, where you want to tell it to fit underneath the scaling section. You want to fit it to 1 page wide by 1 page tall. And notice that I've selected landscape here too, so that I will put it in landscape. So by setting up those 2 parameters, you will tell Excel that you want it to squeeze whatever you selected in the print region onto 1 page. Now, if it doesn't look right away, if, for example, all of your 6 graphs are scrunched up into 1 quadrant of the page, then you sometimes have to go back and change the shape and sizing of your graphics and maybe squeeze some of the columns together. So, you know, you might have to go back and forth a little bit to make it fit in the right way so that the size of the graphics is large enough and the balance of it on the page works well for you visually. So don't be afraid to do that. You know, going back to the, if it doesn't look right away, then just go back into the spreadsheet and resize some of the charts, or, you know, make some of the columns more narrow so that you can make things fit in the right way. So that's how we can get everything onto the dashboard page. And once you've done that, you have created your organization's first starter dashboard. And so that would be a really nice tool to have and to just try using in your organization maybe once a quarter or once a month, and then you know, start bringing other measures into the mix and maybe build your way up to a 2- or 3-page dashboard that has multiple measures on it that you can review. I think these formats are just a great practice in any organization for putting data together in a real efficient way so that people can see it and have real quick discussion around it and make decisions about what to do with it. Please continue. I'm going to invite you to share. In fact, I'll throw a question out to you. Maybe you can type this into your chat box. I wanted to invite anyone. Has anyone already created a dashboard in their organization? And maybe just type in a yes or a no, and let me know if you've already have some form of a dashboard like this in your organization. Question from Sarah here, or I'm sorry, from Glenda. Let's see here. How to add the arrow that demonstrates the direction of, thank you for asking. Yes, that arrow that shows the direction of improvement is within, once you click on the chart, I don't have that within the presentation, but I'll see if I can get to it when we toggle over to Excel. Click on the chart and then pull up the drawing tool, and the drawing tool is in your header bar. So there's an arrow in there, and you can just, what you want to be careful of when you're putting that arrow in is you want to be clicked on top of the chart so that you're embedding the arrow within the chart. If you're not clicked on the chart and the chart is not selected, then the arrow is going to get placed outside of the chart, or it will be sitting on top of it, so that when you resize or move the graph, the arrow will not move with it. So that's the most important thing with putting that arrow in, is to click on top of the chart and then go up to the drawing tool, draw an arrow, and then you can click on that arrow and just type good in it and change the font size so that it fits appropriately. And then you know, shape it so that it looks good, and place it where you like to in that upper left-hand quadrant. Great question. I'm glad you asked about that. We'll see if I can do an example of that. Let's see here. There's a few from Jean, we have done a few dashboards. However, you're giving us some additional formatting. Oh, excellent, excellent, good deal, good deal. Yes, that is. My assumption is that many of you do have some form of a report in place, and what I'm hopeful to share with you are just some additional techniques and perspectives on creating these in maybe a more visually pleasing way, or just in a way that, you know, maybe we across the state have more alignment in how we're creating our dashboard views. I'm going to move along here just to keep us on track, and the two things I'm going to cover in this section are stoplight cell formatting and statistical significance testing. So I would put these into the category of intermediate or advanced dashboard design, because they're the things that you may not get to on your first dashboard pass, and that's okay. But you know, eventually you want to keep evolving your dashboard and add in new features to it so that you are improving the intelligence of it and the intelligence that it is providing to people who are using it. And so the stoplight cell is a great visual cue for flagging things that a team should focus on. And significance testing is a really important way of qualifying whether or not an improvement or a decline in a measure is statistically significant. So I want to show you how you can do each one of those. And first, let's tackle stoplight formatting. So here's that example I was talking about before, where you can actually bring together your graphical displays with a stoplight chart. And I found throughout my practice in quality improvement for this to be a really effective way of not only displaying the trend of data, but you know, which is for more operational purposes. That's, you know, the manager in us likes looking at what the trend of data is against the bar, what the target is. But then the strategist in us should be thinking about how are we going year to date on these measures, and which measures do I need to pay attention to just in a quick snapshot. And so that's where a tabular view of the data off to the right with some form of a stoplight summary comes in really handy, is that it kind of flags for you which measure you should pay attention to. And so your eyes, when you first look at a dashboard page, will look for the red and then identify the measure that's in trouble, and then your eyes might walk over to that measure and look at what the trend is there. That's visually what the combination of the stoplight and the trend chart should be doing for a user as they're reading the graph. So what we're going to do here, I'm going to show you how you can take a column in your tabular summary and assign it an automatic color coding of red, yellow, or green. And I typically like to do this with the variance column, to take the variance column and turn it into a red, yellow, and green. And the rule of thumb that I've used is that if a value is better than its target, it always gets a green. So if you hit the target, then you're good, you're green. If you are less than the target, but only 5% away from it, then you can have a yellow. That's you're approaching, you're still not in the danger zone, you're not doing too bad. If you are below the target by more than 5%, then assign a red to it. You can change these rules in your organization. You know, maybe get up to the 10% level, or the, you know, or just the 7% level. I would caution you against going beyond 10% though for flagging something, because once you're beyond 10%, that really, you know, that truly is getting into a pretty high variance. And so, you know, in my practice, I think, you know, somewhere in the 5 to 10% is when you should start flagging performance levels if they're falling beyond, you know, below 5 to 10% or beyond 5% below their target. And, you know, a norm in the financial sector is that budget variances of 3% are always flagged. And so, you know, that's I guess another precedent for a percentage level that you know, you might be even more, you might be that aggressive as well, but if the measure is 3% below, you might start flagging it. So that's the general levels of flagging something as a red, yellow, or green. Let's go through an exercise of taking 2 of these cells and providing the formatting for them to change colors. And the reason I'm only picking 2 for now is that these first 2 measures, the direction up is the good direction. So that A1C testing and the percentage of A1C less than 7, to go up on those measures is good. The third one on here that has a variance in it is the percentage of A1C greater than 9. That one, to go up, is not good. And so we have to reverse the rules on that one. And so what I'm going to do in this training session is just focus on the up direction formatting of the cells. So how can we let's take these 2 cells underneath the variance column and see if we can teach Excel to color code them. And we see we've got one value that's negative 10.3% off from its target. That's the A1C testing. And then we've got A1C less than 7 is actually 3% better than its target. And so that one should be showing up as a green, and that negative 10% should be showing up as a yellow. So how can we go about formatting those 2 cells to auto color code based on the value? Well, go up into conditional formatting, and then so first of all, select the cells first, and then go up in step 2 into conditional formatting, manage rules. And then what you'll get is this menu that looks a little complex, but once you get comfortable with it, it goes real easy. You'll get this menu that gives you an option to create a new rule, or to edit a rule, or to delete a rule. And what we have in this display are 3 rules that have actually been zeroed out. So these rules that don't exist right now. So what I'm going to do is go in and edit them. If there are no rules that exist here, then you can just click on create a new rule, and you can define a new one. But what I'm going to do here is edit these three rules to do the red, yellow, and green formatting. So step one is that I'm going to click on that first rule, and then step two, I'm going to tell it to format only cells that contain, and then step three, I'm going to say if the cell value is less than negative 0.05, then step four, click on the formatting button, tell it to color it a red. And so once we say okay, okay, okay to all those menu options, we come back to the original one, and we'll see what this is what that original menu should look like. And then once you say okay to that, look what happens. That negative 10.3 turns into a red because Excel is now applying this function that the cell value is less than 0.05. And if the cell is less than 0.05 or less than negative 5%, then it's going to color code it red. So if you get the gist of that, guess what? It's just a matter of repeating that 2 more times for the yellow and green. So I'm going to go through these sections pretty quickly here. We're going to go back to that same menu option. We're going to pick the second rule. We're going to go in and edit that and tell it that a cell value between negative 0.05 and plus 0.05 should be a yellow. And guess what? There's an error in this slide because we said yellow should be negative 0.05 to 0% difference. So I made an error on here, and I thought I would leave it in just as a teaching moment. So our value here should actually be from negative 0.05 to 0, and then a color coding of yellow. And so look what happened when I did this is that it gave the 3% a yellow when it really should have given it a green. But if we had programmed that end value to be 0, then it would not have applied any formatting at all. So lastly, let's add green here. We're going to go into that third rule, and here we're going to say cell value greater than 0.05, and what I should have done here is cell value greater than 0. Here's how we then have color-coded. I added the formatting to 2 additional cells, and you'll see that we've got red, yellow, and green here that are getting color-coded based on those rules. So pretty neat function. This is a really nice feature that once you put it in once, you don't have to do this again. So whenever I'm setting up a dashboard, I have to go through this setting up this rule one time, but then it updates automatically when when you put additional values into your dashboard. So this isn't something you should have to do every single month. It should just take a setup, a one-time setup of the color coding. The last topic I want to hit on here, and I see I'm running into my final stretch here, is testing of the data. And I wanted to I'm just going to cover this in 2 slides because it's a topic that probably could be covered with a lot more time, but this isn't a statistics course. And what I instead wanted to provide you with is just a way of flagging in your data whether or not you have a significant difference occurring. One of the most common questions I get is whether or not the improvement or the decline that I'm seeing in a measure, they're wondering if it's significant, statistically significant, and whether or not I should pay attention to it. So is a 3% level of improvement or 3% level of decline something I should pay attention to? Is a 5% level of improvement or decline something I should recognize or do something about? Is it 10%? And so on. So it's really important to be able to look at your measure from one month to the next and flag whether or not there's been a significant change in it. Now, for those of you who've taken a statistics course, you know that the answer to that question relies upon the sample size of the data points in each one of those periods. And so what I've provided here is a quick lookup tool for you to see, based on the sample size of each period, what level of a difference it would take for the change to be significant. And you'll see here that if you've got 2 samples of 30 data points, it would take a 19% difference between those 2 values. Say it was, say your A1C, you had 2 sample sizes of 30 of A1C less than 7, and maybe you improved it by 21%. You would say that that was a significant improvement. If the change was only 15%, though, you would say that is not a significant improvement. because it needs to hit the 19% change level in order for it to be significant with a sample size of 30. Look what happens to the amount of change needed for a significant change, the larger your sample size gets. So the larger your sample size gets, the lower the change you need to demonstrate a significant difference. So if you've got 1,500 diabetic patients and you improve your A1C less than 7 by 4% from one period to the next, you have shown a statistically significant improvement in your data that you can recognize your organization with. So let's go through one quick other example, and I think I might have already spoken to one, but here's a second one about A1C testing. So say we've gone from on 1,200 diabetics during one period and 1,100 patients in the next period. Say we've gone from 91.7% to 86.4%. Well, that change is 5.3%, and the question might be, is that a significant change? Well, let's go back to our table, and we see that our table is missing some rows on it. It doesn't give us all the levels that we need. There's only an 800 row and there's only a 1500 row. But we see that the difference needed at the 800 level is 5%, and the difference needed at the 1500 level is 4%. So what we can do, what I'll give you permission to do as a statistician, that you can take the midpoint of it. And since we have a sample of the 11 to 1200 range in each of our periods, what you can do approximately is say that a 4.5% change is significant here. And so our conclusion would be that this measure has significantly declined. And isn't that a real powerful statement to make as you're sharing your dashboards and talking about the change from one period to the next? You want to alert whether or not a significant change has occurred, and if it's an improvement, you want to recognize that and put in your monthly newsletter that a significant improvement was achieved. Or if it's a significant decline, you want to get on top of that and do something about it. So this is where I would call this the third most important feature to incorporate into your dashboard and commentary to incorporate in your view of dashboards. The first being a trend of the measure. I think that's the most important feature of a dashboard, is that you're trending measures so you can see what the trend is. The second is to have a reference point of a goal or a target that has been informed by an external benchmark. And then the third is to identify whether or not you have significant changes occurring. If you have those three elements coming together in your dashboard, you are providing a lot of intelligence to your organization on how that measure is performing. So I'm going to wrap up here with just a few sparse minutes in our hour, but for those of you who can stick around a few more minutes, we'll open up the floor for questions, and we're not going to hang up right away here. I'll stay on the line as long as we need to answer your questions. What's going to be happening is that we'll have continued coaching and training on use of these dashboards at the consortium and individual level. I've got a number of focused training sessions and webinars scheduled with different regions, and I'm a resource to the different super regions and consortia offices. So I'm not going anywhere. I'll be with you for the full length of this project to continue coaching and helping you develop these dashboard tools so that you can use them to help support improvement, which is the whole aim of the RISE project. What I'm hopeful that you're doing is taking steps forward to take dashboards that we've now brought to the consortia level, and hopefully you can start doing this locally and start populating them with Q1 data and begin piloting use of the dashboards, and coordinate with your consortia office about any additional group or general training. And as I said at the beginning of this session, please feel free to send specific questions. I'm more than happy to work with your region and work with even individual centers if there's custom questions that you have as you're designing your dashboard tools. So I'm going to pause here, and at this point, we can turn off the muting and open the floor for questions if you'd like to speak them or type in the chat box. Something I could do as well, which I think I'll start doing while I'm waiting for your questions to come up, is I'm going to go over into Excel and I'll show you how you can put that arrow in. And so I'm going to go through a function. I'm going to share my screen with you. So please jump in if you have some questions that you'd like to ask me. score, type them into that chat box. And it looks like everyone is unmuted now, so feel free to jump in. And what you see now is my screen. I'm going to jump over here and go into a sample RISE dashboard page. And I don't have access in this view to your question, so let me I might have to toggle back and forth to see if you're typing in any questions. So it might be good if you have a question to speak it for now while I'm sharing my screen with you. But here's how you could, if you want to put an arrow into this A1C box. And look what's happening here. This is how what it means to be selected and not selected. You see what it looks like when a chart is selected. And then let's go in. I'm going to click on the series and look at how it points to the data that it is referencing off to the right. And remember how I said you can change this to be just a 6-month graph. Look at what we do here. So let's see what happened to our graph. Did it change it? Yep, it sure did. So you can make a little bit shorter graphic there. I'm going to change it back though, because sometimes things like that bug me if I just leave them that way. What are some other things? I'm going to show you real quick. Let me answer the question about putting a arrow in here. So I want to be clicked on the chart, and then I'm going to come up into Insert, Shape, and then I've got an arrow. Here's my down arrow, but there should be an up arrow in here as well. Click on an up arrow, and just draw an up arrow. Make it big enough initially so that I can type into it. What I'm going to do is right-click on this and format it first, so that I'm going to get rid of that blue in the middle. And you can even change that line color if you want to, make it a red or whatever color you like, a green. And then what we can also do here, once I'm clicked on it, is I'm going to right-click and I'm going to say Edit Text, and your cursor should show up in the middle. And here's where I'm going to type in good, and that didn't show up. It showed up in white, but I'm going to change it to black. So now we have a really big arrow here that has good in it, but I can shrink. I can shrink that good down to a really tiny size like that, and then make my arrow smaller too. And then you've also got these yellow handles that allow you to change kind of the arrow aspect dimensions, and so you can kind of shrink this so that it fits. And then maybe we place this in a spot where it looks okay. So there we've got, there's your arrow. And notice how if I now pick up on my chart and move it, it's going to bring that arrow with, versus if I did, here's an example of what happens if you create an arrow without selecting on the chart. So say I create the chart like this, or create the arrow like this, then when I move the chart, it doesn't follow with it. So that's an example of an object that I placed on top of it. And what I should have done is selected first and then gone into Shape and Insert Arrow and down. So there's that. Please jump in if you have some questions there. I'm going to toggle back to see if anyone has typed in any questions. Let me see if I can do that. Let's see here. Oh, we have a note that there's Glenda can't control things when I'm sharing my desktop. Oh gosh, I wonder, do we have anyone on the line? Can anyone speak up and let me know if you've got voice capability? Okay, that might be.
But I don't have any questions.
Oh, okay. I thought I was going to get out of sharing mode and open up the voice. So if it sounds like you guys do have access to voice here. And let me see if there's any other questions. Let's see here. From Lucretia, thank you. This is very helpful, especially oh yes, boy. I tell you, if I could spend a whole session on the significance part, I would. But I tell you, I've given you enough that you can take it and run with it and use it. Use those levels and start showing off that, what is significant and using that term of significant change. And things that you can do in your dashboard to indicate significant improvement. I found it's real nice visual flag. If you found one of your measures has improved, like this cancer screening graph, what's sometimes nice to do during a given month, or if there's been a period of continuous improvement, is for you to take you can take an arrow and maybe take the arrow and rotate it, something like this, and maybe format it with a green, and use that arrow to flag that a significant improvement has occurred. And so that's real nice visual cue that you only put the arrow on. You only put the green arrow on here unless there's been a significant change. And so what actually might be more visually appealing is to go in and maybe do it create it as a pink arrow, so that only the pink arrows are significant changes. And so you could use it on this graph example to demonstrate that maybe this measure has improved significantly. Or on the days to third, you could put this same thing in here. Though actually testing days to third is a little bit different exercise that we're not going to be able to cover today. But say that was significantly declining, you could put an arrow like that in. So those are ways that you can flag on your chart, or just write some text in saying significant improvement. During a given month, you could also do an insert of a text box and just write in here significant improvement and put the big exclamation point on it. Oh boy, music's coming in. I wonder if we're running out of time and have to hang up here. That is yet another text. Or someone's music is going on locally. If you turn it off. So I'm going to go back and I'm going to stop sharing here. See if any other questions have popped up in the Q&A window. And let's see. We've got a few people that have dropped off already, and I'm just going to, I think, turn off our recording for now, and I will just hang around for 4 minutes here. If you guys have any specific questions.